Amy Banks, and I'm going to be discussing the progression of the education of nurses. The first step in nursing is to decide which role you want to fill. Each of us have our own desires that drew us into this field, whether it was because you're a caring person, have interest in the science of nursing, or for the money. The nursing industry called to you. Regardless of the reason, you quickly learn there is more to nursing than the stereotypes seen on television, or those discussed by people ignorant to our profession, accompanied by a long road of education ahead of you. You also realize that it is in no way glamorous. Instead, it is an extremely messy and demanding job, depending, of course, on which area you decide fits you best. Finding your way in a messy and extremely demanding job is just the beginning. Your education and subsequent graduation gives you a newfound confidence in yourself as a nurse, but you discover that it's only the most basic of skills. Then you decide where your heart lies within the field of nursing, whether it's in the general hospital, surgical hospitals, doctor's offices, nursing care facilities, outpatient facilities, home health, or private duty nursing. Even as a new graduate, you realize just out the door that you have a long way to go. This career can provide so much for you, a career filled with endless personal rewards. Nursing can also prove to be very flexible, including a career, schedules, and locations within nursing where you can work. Nurses carry a variety of jobs. They're there when life begins as they help babies be born. They're there to care for the sick. This is the one that we're all known for, standing by the bedside holding their hands, administering medications and treatments needed to heal the patients, and teaching the patients and the families how to care for each other at home once they leave the hospitals or care facilities. And we're there as life ends to offer support for that person to die with dignity. Care, compassion, stomachs of steel, very large bladders, and education are only a few of the qualities that are on the must-have list to be a nurse. Nursing is an ongoing process. In the beginning, nurses were not created equal. They were viewed as subservient. Nurses were viewed as healthcare professionals and not capable of making decisions on their own. As a matter of fact, Dr. Hooker of the Springfield Hospital medical staff in 1894 stated, "Every nurse must remember that it is the attending physician's business to make the diagnosis of disease, and that the nurse should never hazard an opinion upon herself under any circumstance." Then later in 1908, Dr. William Dorland, addressing a graduating class of nurses in Philadelphia, went on to say, "If little knowledge is a dangerous thing in most areas of employment, in nursing it's more than dangerous, it's fatal. Good nursing is not facilitated by too elaborate an education in professional matters, rather it is hampered or even rendered useless thereby." Do you realize how many doctors have come to me on countless occasions and asked me what I think they should do for a patient, or what medications should be given to a patient? May I stand in awe in reflection to how much nursing has changed since the beginning. There has always been debate about what education should be required for nursing. Realizing the need for education, the debate for the education of nursing has always existed. First, you simply had a 2-month probationary period, and that was enough to go to work in the ward. Later, this increased to an initial training length of about a year, with pupil nurses staffing the hospital. So student nurses were were the ones that were staffing the hospitals at that time. Then training increased to a 2 to 3 year program, with the first state board exams beginning in 1913, with New York being the first state to require licensure. Even then, hospital administrators considered student nurses part of the hospital staff, and their training included cleaning, food prep, laundry, in addition to patient care. Pretty much the same from the standards of today as well. Within this history is the increasing need to be educated. The first state board exams in 1913 in New York, being the first state board, the first state to require licensure. Let's skip ahead to 1965, when the American Nurses Association adopted the Committee on Education statement recommending that minimum preparation for beginning professional nurses be a baccalaureate degree in the education of nurses. Up until this point, nurses could be what was considered a diploma nurse. They were trained on the job. Quality patient care depends on highly educated nursing workforce, according to the American Association of College Nursing. The research has shown that the higher educated nurses on staff leads to lower mortality rates, fewer medication errors, quality outcomes in patient care. And more research has revealed that hospitals with a higher percentage of baccalaureate RNs have less incidence of lower congestive heart failure mortality, fewer decubitus ulcers, which are bed sores, less failure to rescue, which is when someone codes, you get to them in time and you actually resuscitate them with a positive outcome. Fewer post-operative DVTs, deep vein thrombosis of pulmonary embolism. That's when the DVT, the blood clot goes into the lungs, leading to mortality, and a shorter length of stay in the hospital. Each of these guidelines focused on by the Joint Commission, all of these are things that are guidelines that we follow today. RN to BSN programs build on initial nursing preparation with coursework to enhance professional development, prepare for a broader scope of practice, which is more what nurses are more capable of doing, and provide better understanding of the cultural, political, economical, and social issues that affect patients and influence care delivery. Hospitals and other employers are encouraged to support nurses to further their education. This support ranges from tuition reimbursements based on your grades, bonuses based on education completed towards a baccalaureate degree, and a raise in pay once completed. It's anticipated that by 2020, the shortage will grow to more than 1 million RNs. That's only 6 years away from now. Even with this shortage, nursing makes up a majority of the healthcare industry. Nursing is the central nervous system of the entire healthcare facility. Respiratory comes to nursing staff. Doctors come to nursing staff. Physical therapy comes to nursing staff. All in reference to what's going on with the patient. It's the fastest growing occupation in the United States. There has been a steady increase in enrollment in entry-level nursing programs over the past few years, with the latest number showing up about 5% in the number of students enrolled. Nursing can be an incredible career. If you're called to this profession, it can be so rewarding. Most patients, staff, and physicians depend on nurses to make these critical, life-changing decisions. We are witnessing another progression in the education of nurses. The requirement of entry-level nurses have to have a baccalaureate degree to begin work. The interdisciplinary approaches to healthcare demonstrate improved client outcomes. Nurses will be asked to participate in multidisciplinary research. One thing is certain, change is inevitable. Where we used to be subordinate, we are now leaders. All departments look to nursing as the center of the healthcare world. We are depended on by patients, by families, and other departments, and now the doctors. How proud would Florence Nightingale be if she were to see us now? How we had changed from the very first steps that she made in nursing to being leaders in our profession. Instead of telling us not to become educated, we're now required to be educated, highly educated. And here we stand at the head of the structure of healing, of the healing process. Thank you.